All attendees are in listen-only mode.
Good evening, everyone, and thank you for joining us for tonight's e-seminar, My Experience with New Concept of LASEMD with Dr. Tatiana Pavicic. Before we start, I will cover a few items of note that will enhance your experience. First, the system will only allow the presenters to talk. This is to keep background noise out of the discussion tonight. Second, we welcome your questions this evening. Please type them into the comments box located on the GoToMeeting control panel. You can enter your questions anytime during the course of the e-seminar. We will answer questions at the end of the presentation. This will keep the presenter from covering the same piece of information twice. With that covered, please sit back, relax, and enjoy tonight's presentation. We are very pleased and fortunate to have for tonight's presenter, Dr. Tatiana Pavicic. Dr. Tatiana Pavicic runs a private practice for dermatology and aesthetics in Munich, Germany. She's a board member of the International Society of Dermatologic Surgery, chairwoman of the Specialist Dermocosmetic Group of the Society of Dermopharmacology, Pharmacy, and a board member of MCAS Academy. She's also General Secretary of the International Peeling Society. With the introduction out of the way, let me hand the presentation over to you now, Dr. Tatiana Pavicic.
Thank you very much, Rich. I'm just waiting to share my screen with you. Good morning, everybody, because for me in Munich it's the morning. Good afternoon to my Asian friends and good evening to my US colleagues. It's my great pleasure to share my experience with the new concept of LASEMD, a device that I'm now having in my office for a little bit shorter than 6 months. And I must be honest, I'm enjoying it every day more and more. And also my staff is enjoying it a lot. They love using it. And also my patients are actually, I never had a device in my office that really so fast achieved that high patient satisfaction, and the patients are so happy. And I will try in the next 20-25 minutes to share this actually experience with you in order to give you an insight how to use it in your office and why I believe that this is a really unique and a new concept of using lasers in our office. So what is actually LASEMD? When you hear it, okay, we see the word laser and we see the MD for the medical doctors. And it's really something unique that combines different technologies and different approaches, because what we knew from all different kind of aesthetic treatments that we are providing to our patients in our office is that we need a combination in order to achieve best results and also to minimize and avoid side effects. So LASEMD treatment is uniquely designed for rejuvenation and to brightening of the skin by combining, and this is really optimized, a gentle laser treatment. I will say a little bit more on that in a couple of minutes, with specifically designed active and effective agents, so ingredients as the cosmeceuticals that are filled ampules, something that in the ampules that you can see on my right side, and that work together synergistically to stimulate and rejuvenate the skin. So what you have in your office is actually a device, and I don't call it a laser because it's not a simple laser. It's a device, it's a station, and a special LASEMD ampules that, as you see, look very fancy. So the women really like it, especially those who are taking care of a design and so on. And this both together results in a LASEMD treatments. Why this combination? And as Rich actually said, I am dealing for many years with the cosmeceuticals in our section for dermopharmacy, working with people from the different industries and also people as doctors, pharmacists, and the providers of the raw ingredients. And we all face certain challenges regarding the cosmeceuticals. The first thing is, we say, oh, it's a topical. It actually does not work because of the low rate of penetration. And if we work just with cosmeceuticals, we are also limited due to the regulatories. So if we look at the penetration, we know that actually that less than 0.1% of effective ingredients really penetrate into the epidermis. We say it is actually epidermis and activate fibroblasts, where we have a fibroblast in the epidermis, but we know that this is a kind of a very short-lasting effect. So what we mostly achieve is actually a short-lasting moisturizing effect, and therefore when you look at the clinical studies, even if they are double-blind, placebo-controlled, of the high level of evidence, the studies about the cosmeceuticals topically applied are predominantly on the periorbital area, so the growth suite, where we have a very thin skin, very superficial wrinkles, and we can achieve actually the best improvement even with the moisturizing effect. The another problem is very frequently and more we face people who have hypersensitive skin, people with a kind of the atopic diathesis that very frequently develop hypersensitivity. And in many of the cosmeceuticals, and if we are honest, the more expensive they are, the more ingredients we have there. And most of the ingredients used, they have a short shelf life, like for example, all the vitamins, like the vitamin C. We know if you buy a bottle or a flacon, and after 1 month, it's probably only 10 or 20% still effective with the vitamin C there. They contain many additives that works like a preservatives, color, fragrances, emollients, or whatever. So we would never use these products with preservatives, color, fragrances, or emollients in people with a very sensitive skin and hypersensitive skin, atopic dermatitis, but also not after a kind of the barrier impairing treatments like lasers, like peels, or whatever you want. And another problem is really the bioavailability. So before we even reach the skin, as I said, we maybe have only 20% of the effective ingredient there because it's unstable or it breaks down. So even we have the problem with penetration, we have ingredients there that might not even be present in effective enough concentration. And then if we use it 3 or 4 weeks after we have opened it, it's also due to the sunlight, oxidation, heat, or whatever, people keep it in the bathroom, we don't have even the same percentage of the effective ingredients there. So, and this was the background to develop a new concept, how to combine actually cosmeceuticals and how to bring a higher concentration of the active ingredients and also to keep them stable and to avoid the side risk of the hypersensitivity due to preservatives and needle preservatives, fragrances, or whatever. So this is a kind like a white MD, a medical part, but concerning the cosmeceuticals, and of course how to make it possible to achieve even a deeper layers of the skin that you can do only with the topicals, like for example epidermis. So what the LASEMD station or the laser behind the LASEMD station does is to create multiply, really 10,000s of laser microchannels that reach, depending on the energy, of course, that you are choosing at different levels of the skin, the epidermis, going through the whole epidermis to the basal layer, or the upper dermis. The trick with this here that is really unique to deliver materials into the skin is actually that the scaffold of the stratum corneum remains intact. And the next step is then to combine it, a combination. So we have the ampules, we activate them immediately before applying it onto the patient's skin and immediately after the laser treatment, so the channels have been created. And these ingredients are in form of the nanoparticles, and they can easier penetrate into the microchannels and also achieve a higher concentration. And as we don't need a big channels because of the nanoparticle size, we also reduce the pain and the downtime to the patients. And what you see is actually that after, I would say 2 hours, depending a little bit on the skin type, the microchannels are closed. But as we have these high effective, high concentrated nanoparticles in the liposomes, even when the patients, and this is what patients do, they continue the treatment at home as the maintenance after they have left our office, as they receive the ampules for another 2 weeks until they come for the next treatment, these molecules still can be absorbed into the dermis. And if you look at the low right side of my screen, we see the skin biopsy after the treatments of LASEMD. We see the scaffold of the epidermis, but this is a very one, but we see also the channel, the real channel. It's not just the debris, it's a channel that is formed where our active ingredients from the ampules can actually be stored. So a little bit technical stuff. We are working with the devices, and there is always something technical on it. What are the characteristics of the LASEMD station? You see the wavelength that is used to create these microchannels is 1927, the thulium laser, and with the fiber, we can actually adapt the energy according to patient's needs, to the indication that we are treating, and also due to the, of course, pain sensitivity of the patients. I always say if I have a patient coming from north part of the Germany, I can choose a maximum level, but if I have patients coming from the Middle East, I rather have to reduce the energy. We have a power of 5 watt, and then we have different treatment modes and the levels of the energy that I'm going to describe more into the detail, and also the other parameters, what depth we can achieve, and the beam size is always 100 micrometers. And you see, these are really micro channels. 100 micrometer is very small. You don't need any calibration, so you actually switch on your device and you can start the treatment. Why I said the station is not only a laser. Yes, there is a laser, the thulium laser with the fiber, but we also have embedded incubator. I already have mentioned we activate the ingredients in the cosmeceuticals, in the ampules, immediately before starting treatments. And despite, of course, the cosmeceuticals and ampules, you don't have any consumables. And we all that are running our private office, we know that sometimes the device seems to be not very expensive, but actually if we look over the 1 or 2 years when you have the device in our office and we have a very expensive consumable, in the end the whole treatment seems to be very expensive. So it's very small. In my practice, we call it actually our baby laser, because we have the Echo, we have the Icon, we have a couple of others, and they're all much bigger than this little one, and it's also the weight is 13.5 kilograms. So actually, if we would have a kind of a suitcase where we can safely transport it, you can actually transport it and carry it with you, because it's only 13.5 kilograms. Sometimes my hand luggage on the planes is even that heavy. Why thulium laser? 1925 nanometer has been chosen. We know there are different actually lights and different source wavelengths that we can choose, but 1927 is really ideal for creating channels by non-ablative treatment into the epidermis and upper dermis, because it only moderately absorbs the water. So what we see here, we usually know there are many of the non-ablative lasers with the 1440 or 1540 that would be around here. We have 2100, and we see the water absorption. Here we have erbium yak laser 2940, and of course we have CO2 at 10,600. So where we are here actually around at 1927. So we have only a moderate water absorption, not as high as, for example, with the erbium yak or with the CO2 lasers, but a little bit better, and therefore we create really the channel than with, for example, 1440 or with the 1540. The other advantages, when we look at the absorption curve of water, this is what I have described, but we also know that we have to manage also the side effects, and side effects with lasers very frequently come to the higher absorption either in the oxyhemoglobin or especially in the melanin, especially in the darker skin types. And we look at this wavelength, we see the absorption actually, I would not call it a zero, it's not a zero, but it's very, very low in the melanin. So we really have minimized the risk of having side effects, especially in the darker skin types. These wavelengths have several unique properties and also advantages, I would call it, not only properties. We have more tissue coagulation, this is what we see here, than ablation. Why? With this wavelength, the stratum corneum does not really have that much water, so therefore we have these preserved scaffolds of the epidermis. On the other side, we look at a little bit deeper layers, in the deeper layer of the epidermis or even in the upper dermis, we know that this has simply more moisture, more water. So here it reacts a little bit better with our chosen wavelength, and therefore we have channels. So therefore we can use it for many different indications. I will show you at the end of my presentations what are our favorites. But the most frequently asked and also used is, of course, pigmentation, photo damage, fine tactile abnormalities, scars, surgical and superficial acne scars. Of course, if I have ice pick or the very deep acne scars, I would rather choose my CO2 laser, and of course actinic damage. Not a very severe one like we have in Europe, but actually all around the world people now start very early to do prevention, to use sunscreen. So the actinic damage, I hope in the future will not be that big issue that we really have to use many invasive treatments. And we see here what is the difference between the LASEMD, so the 1927, the thulium, and why not choosing the erbium or CO2 lasers or a mechanical or radio frequency microneedling. So when we look at the erbium YAG, it is a little bit similar to the LASEMD. We have seen actually the water absorption is higher. It makes channels, but as this water absorption is higher, even in the layer where we have a lower water content on a moisturizer, this is also destroyed. And therefore, with the erbium YAG, the stratum corneum scaffold is not preserved. That means clinically for the patients, they have a longer downtime, and it might happen that we even have overstimulation or simply more irritation and more side effects when applying cosmetics. The erbium glass, that is very frequently used for non-invasive skin regeneration, for treatment for striatus dance, for treatment of acne scars, actually does not create any channels. It creates a micronecrotic column. That's what we see here on the left in the histological picture. It is good to stimulate the skin, to induce the process, to start the process of wound healing in order to enable the skin to regenerate itself. It results in the no collagenesis and osteogenesis, but it's not really effective for the application of the cosmeceuticals, so active ingredients, as we don't have a channel. And we see also that the penetration, and this is what we know from the erbium glass, that we go even up to the mid or dermis or whatever, depending on which energy and of course applicator you use and the system, we have a greater erythema and a post-treatment downtime. And this is definitely what I can confirm. I have a 1540 nanometer laser in my office, and these patients, when we work in the face, they have erythema, and you see also the microspots, the brown microspots in their face. In the Caucasian skin type 2, that is most frequent in Germany, about 3 days, something like that, could even be longer. On the décolletage or neck can even be up to 1 week, and the other non-facial areas. And if I compare it with the LASEMD, to be honest, in the face, you have it only for 2-3 hours, but not really that visible that someone would ask you, what have you done? It seems like you just have spent a last 2 hours in the gym and a nice erythematous appearance. And you don't have any downtime. And this is the same also for the non-facial areas. CO2 is, of course, great to cause channels because it has a really deep channel going even up to the mid-deep dermis, depending on the energy that you choose. But, of course, we know this has a significant downtime and treatment discomfort. I just yesterday had a patient that flew in on Monday from Ankara, and I saw her 48 hours later, and she had our echo treatment for acne scars and also skin regeneration. And, of course, you see a little bit of the crust, a little bit of the debris. I would say still, she was walking around in Munich, even with echo after 2 days. You have actually patients that are not ashamed to walk around because nothing is really having that long downtime, but still, it's a big, big difference, and many patients would never accept it. And there would be also another disadvantage if we think about the combination of the channels where we want to apply the cosmeceutical about that, as we have the coagulation zone surrounding the channel, and this might inhibit penetration into the skin, and plus that we of course have some serous fluid that also would on the one side change the concentration of the active ingredients, dilute it, or push it back because the channel is already full. There is not enough space on it, so the active ingredient in the cosmeceutical would again stay just on the surface. The same thing like a topical thing. If we look at the RF microneedling or a mechanical microneedling, and I'm not really that big user of derma rollers because I believe we have better options now for our office. They create channels, of course, but this channel closes very, very fast, and we again also have the serous fluid that dilute to push cosmetics out, so we in the end would not bring that high concentration and have a much longer downtime. This is a station. It's a really modern design. My patients, when they see it in the office, they say, wow, what is that? It looks a little bit like you would be in the Space Shuttle Enterprise, because it's this transparent, dark, sky-colored interface. These small dots look a little bit like stars, and it's a very, very simple to use. You see it, actually, this is all what you need. It's self-explaining. For example, my staff actually, after 1 day, they know actually all the functions, or after what means 1 day, after 1 or 2 hours introduction, they know all the functions and how to use it. Patients like it because it looks very spacey with the blue LED lighting. So of course what we have like everywhere, and I'm not going to go through this because that's what you can read everywhere. What is important, we have 2 different modes, and I will describe you a little bit. We have the advanced mode and the easy mode. It already says a little bit. The advanced mode, there you can play more individually, and then you can choose a different energy levels, but really determining the energy and choosing the energy that you want to have by pushing up and down buttons. And you see here the energy in millijoules shown between on the steps 1 to 20 millijoules. Or if you use an easy mode, you have level 1, 2, 3, and you control everything by the up and down button. It's very, very easy, and there is no really need to explain it very, very long, and you can choose also the power between 1 and 5 watts. What is this? This is what I said, why we don't call it a simple laser, but it is a LASEMD station. This is an incubator. You open your ampule, you connect the 2 chambers with the powder that is containing active ingredient and the solution that we need in order to be resolved, and then you put it in the incubator, and during the laser treatment that we are performing, your ampule and your active ingredient is activated. This takes really exactly the same time if you're working with the easy mode. There is very short, but I want to keep the tension a little bit longer, so how long it really takes, and then apply it immediately thereafter. And then ready and standby, and I'm someone who always forgot to apply a ready, and then I'm wondering why it does not work. This is very easy because you see that it's standby is lightening, and then you have to switch it just to the ready. We have 2 different ways to treat, dynamic or the static, and I will explain, I think, on the next 2 or 3 slides how it works. So this is a handpiece. I, as a woman, love it really because it's very ergonomically designed. It's not heavy. I can treat the patients the whole days, and I will not feel like I would have spent the whole day in the gym, like with some very heavy handpieces that we have. It's very small and simple to use. It has a magnetic roller tracking system that ensures and increases the safety of our patients. So actually, the energy is only applied when the rollers are on, both of them, and connected to the skin, so that the energy can really be applied only when we want it to apply. And this magnetic roller tracking system, we see, these are the small rolls. We have a couple of shots when the rolls are rolling. You see 1 shot here, then it rolls a half or a quarter another, then another shot, another quarter, and shot and shot and so on. So how many shots do we really have when we are rolling? If we choose a power of 5 watt laser delivers, we have about 10,000 microbeams per full phase pass. This, of course, depends how fast you are working. So, for example, if you are working in a dynamic mode and this is really adjusting the scan speed automatically to how fast you are moving. Of course, you should not be very, very fast because you think you are done, and then because then you don't really give a chance to have a 10,000 microbeams at these times. But still, if you choose the proper speed, this will adapt to the certain level automatically, and then really, and this is a magic number, the whole treatment with an easy mode, for example, is done in 6 minutes. And that means not only that you're treating the patient 6 minutes, that means that the whole procedure takes 6 minutes. So the patients come into the office because we have 100 micrometers beams. It's extremely small. We don't need any preparation. Just clean the skin, of course, but I usually ask my patients always to come without makeup to my office. We don't need any topical anesthesia. And I must say, I tried myself, you will see it later, and it's really, you don't need a topical anesthetic. So you can, patient is coming in, cleaning the face, laying on the chair, you choose the proper ampule, and actually you start the treatments. And that's the trick. Whereas you are treating the patient with the thulium laser, your ampule or your active ingredient is activated, you finish your laser treatment, the incubator has done the job, it's click, it's done, and then you can apply the activated ingredients onto the patient's face, and thereafter, of course, patient has a good time, as we will do something else in order to increase the penetration and also to increase the patient comfort and reduce maybe a possible appearing erythema. Of course, you are not stick to these 6 minutes. As I said, we have even different modes, and for different indications, we can choose different energy levels for a different severity of the indication. We can choose also additional passes to enhance the effect. This is what we have, a dynamic and the static mode. Dynamic, of course, working with the foot switch and the rolling, so only when you are rolling, the energy is applied, causing microbeams. And the static, that is the foot switch only, like you know from some other devices. And of course, we see, like on the right side of my screen, the dynamic mode. We have, of course, less spot density because we are rolling a couple of the times over the area that we are going to treat. And with the static mode, we have actually higher density of the microbeams that we have there. So I'm, for example, having the areas that are curved or very difficult to be treated, like around the eyes. I sometimes choose the static mode because then I immediately, with 1 or 3 or 2 to 4 shots, depending how many passes I'm choosing, I have actually more microbeams where my cosmetical ingredients can penetrate to it. So this is a short description of the device, what you have to the station. The benefits are really that it creates 10,000s, many, depending, of course, how many passes you choose as well, laser microchannels that, depending on the level that you choose, also can reach either the epidermis, penetrate the total epidermis, or reach even the epidermis. It's as a very small 100 micrometers and short pulse beams. It's absolutely practically painless. Yeah, it's a little bit, but my patients say, if I don't feel anything for what I'm actually paying my money, but you don't need any anesthesia, and a great advantage for the patients of today, because they have everything, they only don't have time to stay at home, is there is no downtime. It's safe and very fast because of the magnetic roller tracking systems. It's very compact and small handpiece. That's for a woman very, very practical. And I really like the design because it's different from the other big devices. The screen is really looking a little bit spacey, and you can immediately use it. There is no calibration, there is nothing else to start, and you have a different modes that you really can individually adapt the treatments. And this is another magic world of the aesthetic treatments today. The one is the combination and individual adaptation of every kind of the treatment and to adjust it. So let's come a little bit to cosmeceuticals, another actually area of research. This is really something that is representing also a guideline, but also this research that I have been involved for about last 6 years. to use only proven in the clinical studies, evidence-based effective ingredients, and also to use as little as possible ingredients, a so-called cosmetic minimalism. Less is more, in this case that's true, and to combine only essential ingredients. It's specifically designed for application after laser treatments. As I said, cosmetic minimalism, there are no preservatives, no artificial fragrancy, no artificial chemicals, so nothing that would potentially hypersensitize the skin or irritate the skin after the laser treatments. In order to have a better penetration and to can use even a very small microchannels, as I said, the particle or the ingredients are in a nano size. That means the active molecule has different sizes. It's under 100 nanometer. It's about 150 nanometer size. This is something maybe a specific European problem, but we had a big discussion about a couple of years ago about so-called nanoparticles, because there have been some rumors, like always, you know, we also had these headlines, Botox in the brain. It's of course not true, but this was also one of the headlines in the newspapers, nanoparticles in the brain, you are getting dumb if you're using nanoparticles in your cosmeceuticals. And this is also a difference. We are using in the LASEMD ampules nanoparticles of the average size 150 nanometers, but for the European regulation, what we actually call nanoparticles is the size under 100 nanometers. So even if it's a nanometer, we would not consider it really in Europe as some people consider dangerous. It's proven that it's not actually, but still there are these rumors. What is another difference? Why we can use it also after the channels have been closed? It's a multi-liposomal granulated technology. We know that we very frequently use a so-called transport molecules like liposomes or allosomes in order to transport molecules that usually would not penetrate to the effective skin barrier, but we can use, for example, liposomes. And this is what is used to actually to connect the active ingredients in this nano size into the liposomes. We also know that the products that are packed with the liposome technology has a better tolerability actually into the skin. This is something I already mentioned, so if you listened carefully, it's a dual chamber system. Some people maybe know this dual chamber system. This is the best way to maintain the efficacy of the active ingredients. So it's not, there are no preservatives, but why? In the upper chamber, you have a powder, that's the active ingredient. Whatever we use, vitamin C, tranexamic acid, retinol, or whatever, vitamin A. And then actually, you connect, and in the lower chamber, there is liquid for the reconstitution, because we have to apply, the powder would not work and it would not be cosmetically pleasant and not accepted by the patients. And then after connecting these two chambers, you put it into an incubator and activate it immediately before patient use. So that means you have the 100% of the effective ingredients that are mentioned on the ink list up there. And what kind of actives we can actually use? You see here, the one is VC, ascorbic acid, vitamin C in the content of 10%, and we know there are evidence-based clinical data in the double-blind, placebo-controlled study showing that the vitamin C in 10% has a really significant effect on pigmentary disorders and also as the co-activator of the neocollagenesis, so we can use it for brightening and anti-aging and also for prevention, preserve instead of repair the aging. Retinol, vitamin A in a VA, 2,500 units for wrinkles, but I also like to use it, for example, for acne scars and everything where we need to support the skin regeneration. Tranexamic acid, 1.2% TA for whitening and for redness, because it has two actually ways of acting. Resveratrol as the antioxidants for whitening and anti-aging, and lucky guys in Asia, they can use it. SC, human cord blood cells, 20% for regeneration, and SK, human cord blood cell condition media, and KGF and genistein in 20% for regeneration, hair loss, hair growth. Unfortunately, due to the European regulatories, we don't have these last two in Europe, and I'm very sad about that, I must say. And why I said this actually fits exactly to the work, and therefore I was very happy to be one of the first in Europe to use it. This is the guideline that I have developed with really professors from pharmacy, for dermatology and others. Cosmeceuticals with anti-aging effect, what is evidence-based, and when you look at the left side of this chart, in vivo proven effectiveness, placebo-controlled double-blind clinical studies, retinol, vitamin C, peptides, low molecular AHA, and you will see all of that in the ampules of LASEMD, and no placebo-controlled double-blind, but objective methods and in vivo study, and here we see resveratrol and others. So this really is our evidence-based ingredients for cosmeceuticals with anti-aging effect. I was speaking about a little bit of the patient comfort, and there are two other things that you should use and also to increase the penetration. There are two different things, LASEMD absorption and barrier cream pack, that is like a cream. It's really containing a multilamellar emulsion technology. Why multilamellar? And maybe those people who know also Physiogel, they were the first introducing that. We know that our skin actually barrier is a multilamellar layer barrier, actually, with the cholesterol and the enzymes and so on. And this exactly actually copies and helps the natural barrier that is a multilamellar, multi-layer to restore after we have applied the laser and to reduce the moisture loss. And it's actually suggested not only immediately as the post-care following the LASEMD treatment, but also you can use it as the daisy moisturizer. And it's a box type of 14 pouches like this one here. I must be honest, I never managed it to really apply the whole on my face because it's simply too much there. Or you can use a tube type like here. So it's also a minimum ingredients, only 13. It's free from perfumes, free from dyes and conventional emulsifier, and free from silicone and mineral oils and paraffins. I actually gave it to some of my patients that have atopic eczema, and they really love it because it doesn't burn and it even reduces their erythema. So this is maybe another way of using it. What is the function? It repairs the barrier, as I said. It increases the moisturizing and decrease the moisture loss through the channels. It also reduces, as I said, itching. This is the reason why I gave it to my atopic eczema patients. And it's occlusive agent, so it boosts the absorption of the LASEMD molecules of the active ingredients what you have chosen. Or you can use it together with the cream mask pack, really like a mask. It's the world's first biocellulose mask pack with cream applied instead of liquid. And you see here the difference. The others, cream mask packs, don't work really like occlusive. So we lose a lot of the fluid, and fluid is easy to be lost, to go out. Does not help really our skin, and the movement of the active ingredients, and then bidirectional into the skin and into the mask, but it doesn't help me to go in the mask. In contrast to it, the cream mask pack, we see here the LASEMD cream that you have also in the sachets is applied just on one side, but it can't actually escape on the other side because this coconut-based material acts as an occlusive dressing. So you really have a wound dressing so that you have a maximum effect on the side where you want to have it, to the skin, and not to lose something on that. How does it work? Patient is coming to the clinic for the consultation. We talk with them what they want, what is the indication, and so on. Then, and of course, do the consultation about everything that is interesting into the treatment. We choose the ampule, tranexamic acid, vitamin A, vitamin C, or from the exclusive line, resveratrol, or if you have it, like I said, stem cells combining. We put it into the incubator. The ampule is incubated, whereas we are doing the treatment with the LASEMD, choosing whatever modality we want to choose, and then we apply ampule. It's approximately 2 milliliter, so 8 pumps of the 10 milliliter, so the patients get the rest to use at home. And then we wait for about 1 minute, and then apply LASEMD post-care treatment, so either the cream Or the mask, if you do the mask, it takes about 30 minutes. So patient is laying there, maybe you can offer them some other treatments like, I don't know, foot massage or manicure or pedicure or whatever you have in your office. So you can even earn more money, and it's increasing our business. There are really very clear and easy to use treatment guidelines, easy mode. I would recommend it for the beginners or doctors who are afraid, or if you have a very sensitive patient that is afraid of everything. This is what has been chosen. So for example, you have 3 levels, level 1, 2, and 3. And if you want to treat the melasma and whitening, you choose level 1. That is going only to the epidermis, about 100 micrometers, and use a TA ampule using a dynamic mode. And it's usually depending. With melasma, I use only 2 to 3 passes. But if I have acne or wrinkles, I use 4 to 6 passes. And interval is 2 weeks. Recommended are 5 sessions with a 2-week interval, but sometimes we can even do it much faster. And if you see, if you have premium anti-aging, level 3, and you can use resveratrol and stem cells, I unfortunately can't. So in this case, I sometimes combine resveratrol and vitamin A. This is what we can achieve. You see, level 1, spiny layer, it's about 50 to 100 microns. This is where we treat, for example, melasma by combining the tranexamic acid. If we choose a basal layer, for example, for a typical anti-aging treatment, it's 100 to 150 microns with a level 2, and then we combine retinoid, vitamin C, or resveratrol. Of course, if you have a very sensitive skin, I would choose resveratrol because we know that retinoid and ascorbic acid might have some irritating potential as well, and so on. These are electronic microscopy pictures showing a microholes by LASEMD. We see this is a back tissue male, 40 years, level 3. So we go about 100 to 150 microns, and we really clearly see defined channels where our cosmeceutical was applied. I predominantly work actually meanwhile with advanced modes for what we call independent indications, but it's rather to adapt it individually. And sometimes I work on the forehead with one level and with one energy because there is a melasma, and then patients have acne scars for the cheeks, and I choose another energy. So you can really play with that for all different indications: skin laxity, deep wrinkles, brown spots. Of course, if you have a very severe elastosis, then I would always choose rather the ablative treatment of the fractionated CO2 for all different indications. And here, usually we recommend 3 treatment sessions with 3 to 4 weeks interval to give a skin a little bit more time to recover. Of course, the higher the energy, a little bit more the pain, but I really never had a patient that did not tolerate it, even if we choose 20 millijoules, for example, for the treatment of the acne scars. So there are many ways to use a simple device. It seems very, very simple for a different indication. And then we see also the skin reaction by advanced mode is also a little bit different. These are not really clear channels, but it's a really a kind like targeted damage of the skin in order to improve regeneration. What is about the downtime? This is a really, LASEMD is enhancement, treatment of different indications without laser-induced cosmetic downtime. We see here, for example, erbium YAG fractionated, CO2 fractionated, LASEMD fractionated. You don't see these spots by the naked eye. It's really indivisible. The only thing that you sometimes see, and of course this is normal, as I said, patient, if they don't see anything, they will say, oh, what have I done? It's a mild erythema and edema. You see here, easy mode level 3, 3 passes for the treatment of the periorbital, in the first case, periorbital wrinkles, but also for the skin regeneration immediately after, even here around the skin. And we know even if you touch the skin, it gets red. Skin type 1. Red hair, blue eyes, patients that get sunburn immediately as they see the sun, maybe even before. Advanced mode, 15 millijoules, 5 watt energy, immediately after. And this is 3 hours for décolletage. On the décolletage, it will last a little bit longer. This is gone after 1 hour, actually. And this is about 3 hours. But on the next day, patients don't see anything. This is what you see if you are treating melasma, for example, or other hyperpigmentations. This is the necrotic debris and pigment that is loughed off as the skin is resurfaced, and this is about 4 days. If you have a really dark spots, extremely dark, like in this case, this is, for example, 3 days in a very dark pigmentation. but you can apply makeup over it because it's not peeling. This is a really small dots. These here, and this is actually myself, I could not really see. This is a 5 times magnification of the new 7 Plus iPhone. Doesn't matter about that, but it's a very big magnification in order to see it. You just feel it with your fingers there. How about the clinical results? This is what very interesting. This is young patient, and you see this was one of my first patients, level 3, dynamic mode, 3 passes in combination with resveratrol. Before 10 weeks, because she didn't come really every 2 weeks, it's because of the time and summer. And you see actually the one thing is not only that her wrinkles that you see here have improved dramatically, and this is without any combinations with botulinum toxin, we see really this brightening effect on the skin, even in combination with antioxidants like resveratrol. This is not a specific treatment for hyperpigmentations. And you also see the skin gets thicker. And of course, I always compare it to my patients. If you have a cigarette paper and you fold it, you much easier get wrinkles. And if you have a printing paper of 100 milligrams, then you can't really close the folds very well. This is a resveratrol. As I said, it's only 7 ingredients. Resveratrol nanopowder, water that you would actually reconstituted, glycerine as the moisturizer, and a combination of the low molecule AHA and the high molecule AHAs. And I loved that, therefore I put it there. 7% of prime gut resveratrol, 99% purity nanopowder, but this is more than 500 bottles of wine. I don't know how expensive that should be if you buy 550 bottles of wine, even if they're very cheap, but it's extremely a lot. That shows how much actually of the active ingredient you have there, and it's a natural polyphenol that works like an antioxidant. Why to combine low and molecular weight of AHA? You see here, this is a study that I have published in JDD in 2011, because they have a different function. The bigger, the higher molecular weight AHA is predominantly for the hydration, and it's also able to increase the elasticity, and the low molecular weight AHA is really also working like anti-aging ingredients in order to improve, for example, skin roughness and to improve wrinkles. And I promised, I have treated myself, not my girl actually treated me, and I was suffering for so many years with this melasma, and all of my colleagues are always joking, oh, Tatiana, you have to do something about that, and I have done. I have tried different peels, different things, and it was much worse before, but actually these last things never really gone away. And I sometimes had even the skin that was black and peeled off, and everybody could see that I have done something. And this is really a single treatment. We choose 5 watt and 15 millijoule for the forehead, 2 passes, because I'm someone who is very sensitive to pain, and I used a vitamin A in my case, because I just wanted to try something different. And you see also here in this area, and we use here actually level 2 of the easy mode, 2 passes, just to do something also with my skin. And you also see how the little dots that I had on the cheeks and the lateral area, also here, it's completely gone after the 1 treatment. And I had it, and I went actually to pick up my son from the kindergarten, and nobody really looked or asked me what have I done, and they all know what is my business actually in my office. So it's a single treatment. I'm sometimes saying, my girls, please tell the patient they need 3 treatments, because otherwise it's only 1. We don't really earn that much money. Another patient, actually, I know this patient for many years, and she also tried very expensive topical creams, spending hundreds, maybe thousands of euros, different lasers also, like Q-switched Ruby, Q-switched Andium, different things. This is a single treatment, 5 watt, 15 millijoule, and this is really not painful, and she's extremely pain sensitive. 3 passes, in this case, TA, tranexamic acid ampules, 2 weeks later. Tranexamic acid, you can use it for 2 different purposes: to help wound recovery, therefore also for erythema reduction, but also to brighten the skin. And it's not irritating because of this multi-nanosome granulated technology, really, what is in it, and it's only 8 ingredients. Here you see we have another antioxidant like a mannitol, and mannitol is also effective to reduce erythema and to prevent aging as its antioxidants. And you see these patients from another side. These are actually very difficult to treat things, because you don't want to use something that is very aggressive, because there are only small areas, but you also see another thing. This this whole skin and the wrinkles here around, they have improved already after one treatment. It's not just to look at the pigmentary dots, but also on the skin texture. And she just had a second treatment yesterday. Another patient, even a more severe case, look at this. This looks really like a diffuse hyperpigmentation, a mixture of hyperpigmentation, melasma, very difficult for for the patient. They need a lot of makeup, and this results always in the end of the day in a deeper wrinkles. This is a patient 3 weeks later, a single treatment, as I said, advanced mode. We always choose actually for hyperpigmentations, 5 watts and 50 millijoule, 3 passes, and tranexamic acid used another day. And this patient was so happy. She came to my office, bring me a big, actually, flowers to say thank. And I know her actually for many years because I helped her once also with necrosis after the filler injection from another doctor. And you have seen these patients. You see, this is 3 days post-treatment. This started about on a second day. And this is 3 days later. Everything is gone of these small dots. There is no downtime actually at all. But what has done, what is gone as well, and we see it's actually even better there, where she had this kind of more severe reaction and a more slaughtering of the pigment and debris is actually a better result. Young patient, and actually we treated her for the surgical scar. Believe me or not, this patient had at the age of 28 upper eyelid blepharoplasty, and she had these scars. And of course she was disturbed by that, but she also had these pigment, and actually she was treated with the scar area advanced mode with 20 millijoule, 3 passes, and these are 2 treatments. And we see this is a significant improvement. Actually on the pictures you see it in life. When you see the patient, you don't see anything anymore. And then my girl did just a little bit of the easy mode too around the face, and she used vitamin A so for the scar, but not around the face. This is only the laser treatment with a little bit of vitamin A cream on it, and we really see this brightening. It's the glow of the skin. She's a young girl, she does not have wrinkles, but she looks more attractive because of the brightening of the skin. So I think I could really show you my amazed mood for this treatment. I really love it. I never had something that was so small and really caused that high patient satisfaction. To conclude, it's a unique design treatment for brightening and rejuvenating the skin and also treat the scars that you have seen. I combine it by combining the laser treatment to have thousands of small microchannels in order to give a way to reach a deeper layer, the epidermis, or a thulium laser, and combine it with exclusive, really evidence-based ingredients for different purposes. As we have these small channels and we work very fast, there is actually painless treatment. You don't need any anesthesia. Patients don't have actually no downtime, 1 or 2 hours that you can cover with the makeup. It's nothing really serious. In 6 minutes, if you use the easy mode, it's done actually. It's safe because we have the magnetic rolling system. And you can, for every patient individually, adapt the treatment by choosing either different cosmeceuticals, different ingredients, and also by choosing the easy mode or advanced modes and the different energy level. And it's a really cool design. And this is, as a woman that is always taking care of dresses and shoes and bags, I like in my patients as well. And it's, as you have seen on these, a couple of pictures from my patients, it's extremely and very fast effective. I would say maybe even better, at least comparable to some more invasive treatment and multiple indications with extraordinary high patient satisfaction. My patients who see these pictures, they say, I want to have it. Thank you very much. And I hand over, I think, now to Rich back, or whoever is taking.
Yes, thank you very much for your presentation, Dr. Tatiana Pavicic. For our listeners, if you haven't already done so, please enter any questions or requests for further information by typing them into the chat box located on the GoToMeeting control panel. We will cover as many of them as we can in the time allocated at the end of the presentation. We apologize in advance if we do not get to your question. So let us open up our session. And one of the things I think I would like a little more information on Dr. Tatiana is I noticed your patients were younger, and I guess let's just ask you a little about the typical patient that you would see and what you would recommend for LASEMD treatment. What is that person that comes into your office, and what are they searching for, and who would you most likely recommend a LASEMD to in your patient pool?
Actually, you've seen they're different. This one that I said had a very severe pigmentation. She's actually 56. So sometimes even German patients look a little bit younger than they are. This is not the case just in Asia. I really individually assess all of the skin quality. So if someone has a severe elastosis and it's complaining about the deep wrinkles, I would not probably choose as a first option LASEMD. Then I would rather recommend them my fractionated CO2 treatment. But for LASEMD, I see all the patients, independent of age, that really have pigmentary disorders and different types of pigmentary disorders. The classical melasma, we had some patients like with the post-pregnancy melasma. I see it in older patients that have diffuse hyperpigmentations because of the photoaging and maybe also due to the hormonal disturbances. I see it actually, and we had yesterday just one patient with patients with large pores, a little bit of the acne skins, like acne tarda in the older patients. We see this improves actually also the inflammation, but it also improves if there are acne scars. And we see, I actually love to combine it with all the patients that are coming to my office, for example, for botulinum toxin treatment. Doesn't matter if it's periorally, periorbitally, or forehead or glabella, that has a very slight initial superficial lines, but that we know from the experience that will not go away only with botulinum toxin. Then I recommend them to additionally combine it with the LASEMD, or those patients who come to my office and said, you know, I think I'm now at the age of 35 or whatever, because I have a lot of young patients, because my motto to work is preserve instead of repair, and it's really one of the first sentences of my homepage. And I think this is a great thing really to prevent that we develop more severe laxity, more severe wrinkles, because we can use it really for that. We don't have any downtime. It's not really painful. It's very fast. It fits in our lunch break treatment, and this would be my preferred indications. But actually also the older patients just want to refresh and provide a glow for their skin and are not ready to have any downtime. This is great for them as well.
You showed yourself as well as some others with melasma. How many treatments would you typically use for melasma, and has this become one of your best approaches for treating melasma at this time?
According to my really personal experience, it is really. I have tried also 1540 for melasma, combined with, for example, 1% retinol, even like a topical cosmeceutical. I have did different peels, really combining resacinol and Gessner and things and so on, and I never really get rid of that. You have seen these patients are improved after one, but I recommend them to have 3 treatments, really. The only thing that we have now faced, we have done 2, then the patient said, oh, this is great. We recommend them to postpone the 3rd treatment, not after 4, but maybe 6 to 8 weeks, because just want to give them a little bit more time to see how that will develop. But we didn't have any single case where after 2 or 3 treatments, it came back after 3 months. It stayed as it is. Well, of course, what I recommend them is continue a kind like a maintenance treatment by using either tranexamic acid or retinol or vitamin C or kojic acid, something like that.
Yes, that makes lots of sense.
And of course, sun protection, because we know this is, we can choose any kind of treatment. If we do not consequently sun protection, we will have a pigmentation problems, maybe even a new one, not the old one only.
And your settings for the treatment of melasma, are you tending to use more of the advanced mode settings or the easy mode settings?
We use actually, as you've seen on the pictures, therefore I write it always down what we have done. We use more advanced
Okay.
settings. But at the beginning, we used more easy, and I must say, longer we have the device, and I have one of my girls, she is, I would say, a biggest fan of this device that you can have. The problem is only her English is not perfect. Otherwise, I would ask her to come and talk with us. She is such a big fan, and she's trying all different things. Actually, what she had tried in 3 friends of her, I could not just show it, is actually the genitoinguinal hyperpigmentation in the darker skin types, like a skin type 3 and 4. As I said, we have a lot of Arab patients and patients from Turkey and so on here, and they all complain about these hyperpigmentation, and we know that the whole genital regeneration is now getting, like a big topic, and this worked extremely well with 2 or 3 treatments.
Excellent. Now we know that from histology that the settings, that the advanced node settings of 15 millijoules, even 20, can go 200 to 250 microns into the dermis. And that we also know that with the enhanced penetration channels, we can certainly deliver effective agents into the dermis, the complete dermis. So would you say that the system is effective not only for epidermal pigment, but can also be effective for dermal pigment?
Exactly, and that's the reason that, when I described my picture, I have tried all the things, and this had improved the superficial pigmentation. That is, of course, the darker one, but I never really get rid completely of it. And we know there is an epidermal melasma and there is a dermal melasma. And epidermal melasma is actually, even if you ask also Marina Landau, there's a good friend of mine, she always said, yeah, epidermal melasma is not really a problem. What is the problem is dermal melasma, because with all these kinds of treatments, you can't get really down deep to the dermal pigment, or you have to be so aggressive, and we know the more aggressive, we have, again, a higher risk of post-inflammatory hyperpigmentation. So you don't want to make it worse, and you don't want to take a risk to make it worse. And I think for this is a really unique approach. And all these patients that I've shown you, these were the patients that have tried different treatments with rather kind of a suburban melasma. So therefore, we choose rather the advanced mode, because my suspect, and I look with them on the wood light, it looks like they all have a dermal pigment, maybe a little bit of the epidermal, but we treat that as well with this kind of treatment as well. So therefore, we choose this. If it's a patient coming for the first time and you don't know really how they react, I would recommend to start with easy mode, level 1, and then just to check. And you can still switch. If you have 2 treatments with the easy mode, you can switch to a more advanced mode in order not to cause any problems, but to have the most optimized results. I think even if we have started with 1 treatment mode, we always have to reassess the patients and maybe adjust the treatment to what is needed or what is the new finding in the patient.
Well, that's your information is very helpful. And for treating things other than just melasma, would you tend to treat people at 1-week intervals, or do you tend to do longer intervals?
We sometimes tend to, usually we do the first and the second treatment, like for the wrinkles. Wrinkles is definitely not 1 treatment. It's rather 2, 3, 4, 5, actually 5 with easy mode. But also the scars, like the surgical scar, this one. And as I said, I have also 1540, and we sometimes do a little bit of comparison. And definitely, I would say for the surgical scars, and you can be even more precise with the LASEMD, it's definitely not less effective. I can't really say now it's better effective, but you can be more precise for the very small surgical scars. And here we need 5 treatment sessions. So what we do is usually the first and the second, if we do the easy mode, I really say patients 2 weeks. And if it's advanced mode, I usually say 3 weeks. But then after the second treatment, we usually tend to say it's 4 to 5 weeks, maybe even 6 weeks. Why I do these 2 at the beginning? I think we need a kind of like an initial boost on the regenerating or effect and wound healing process. But then they have a kind of the effect. And I really rather want this to develop a little bit, and also to give them a better psychological satisfaction, that they think, oh, this is very effective. So they rather ask to come 1 week earlier, and this is a good for the patient compliance.
Well, that's excellent. Unfortunately, though, and I would love to have many more questions with you, because you're really, really very clear and easy to understand and have lots of good advice. but we've reached our time limit for this evening. And so I have to say that it's time then to thank you, Dr. Tatiana Pavicic, for your presentation this evening. And I'd also like to thank everyone for attending this evening's event. If you'd like to leave feedback on tonight's event or would like more information on LASEMD, just leave a message in the comment section and we will reply as promptly. If we haven't gotten to your particular question, we'll make an effort to get back to you on that information. Again, thank you everyone, and thank you particularly Dr. Tatiana Pavicic for an excellent presentation.